Welcome to my video. Today I will answer the question given by my lecturer.
Case Study 20. Acting without prior consent due to an unforeseen medical problem. When Mr. M, a 52-year-old male, was referred to Dr. C, he was in a very serious state. His symptoms included fever, headache, dry tongue, sinus infection, and general septic poisoning. Urinalysis indicated his urine was badly infected. He had stones in his bladder and a large stone in his kidney. Dr. C operated on Mr. M in May, draining his bladder and removing the bladder stones. The patient was subsequently treated with injections, and his bladder condition improved. He continued to experience severe pain on his left side and had also developed a hernia. A second operation was performed to alleviate the patient's overall physical condition. Several months after the second operation, Mr. M gave his consent to have surgery to repair his hernia. A day or two after the operation, Mr. M was informed by Dr. C that his testicle had also been removed during the surgery due to potential problems it might have caused. In response, Mr. M said he had not given his consent to the removal of his testicle and had never been informed that it might be necessary. Three eminent surgeons supported the correctness of Dr. C's procedure. They stated that no surgeon could have anticipated the condition, and that further surgery had been necessary. Should Drive C have postponed the operation until Mr. M was able to give his consent? Here are a few, but not all, possible answers. Discuss them, as well as other possible answers. Identify ethical issues and decide which answer applies to you most, giving your reasons. No removal of the testicle was a necessary part of the operation to repair the hernia. The need to remove the testicle could not have reasonably been ascertained before any surgery was undertaken, and consent for further surgery was implied in Mr. M's request to repair the hernia. Yes, Mr. M did not give his consent to the removal of his testicle. Under these circumstances, a testicle can be surgically removed only if the procedure is considered an emergency or life-saving procedure. If it does not constitute an emergency, the physician must postpone the procedure until the patient gives his consent. In this case, however, it must be assumed that the condition of the patient's testicle was not considered to be so serious as to immediately endanger the patient's life or health, and that there was reasonable opportunity to obtain the patient's consent for surgical removal of the testicle. Notes about the case study. Court decision. The case came before the Supreme Court of the country. The court stated that in an ordinary case where there is opportunity to obtain the consent of the patient, it must be obtained. A person's body must be held inviolate and immune from invasion by a surgeon's knife if an operation has not been consented to. Such surgery can only be performed with the patient's consent. If performed without such consent, it is technically an assault. Every human being of adult years and sound mind has the right to determine what shall be done with his own body. A surgeon who performs an operation without his patient's consent has committed an assault, for which he is liable in damages. This is true, except in cases of emergency where the patient is unconscious and where it is necessary to operate before consent can be obtained. In the case at bar, the judge found that Dr. C, after making incisions in Mr. M's body, discovered conditions that neither party had anticipated and that the defendant could not reasonably have foreseen. In removing the testicle, he acted in the interest of his patient and for the protection of his health and possibly his life. The removal in that sense was necessary, and it would have been unreasonable to postpone the removal to a later date. The judge came to this conclusion, despite the absence of express and possibly implied assent on the part of Mr. M. Discussion. Acting without prior consent due to an unforeseen medical problem. In respecting one's human dignity, we respect his autonomy and require informed consent before performing any medical procedure. The patient, who will bear the consequences of the procedure, whether it is successful or not, must grant his informed consent prior to the performing of the medical procedure. To verify the informed component of informed consent, it is essential to ensure that the patient understands his present condition, the proposed treatment, and all of the possible consequences, as opposed to other treatments, or to not having treatment at all. If the patient is not aware of this information, his consent cannot be considered informed. Nevertheless, there are situations where it is impossible to obtain the patient's consent, but he is still treated and everything is done to help him to improve his condition. An example of such a situation is the treatment of a person injured in an accident. Sometimes we are able to obtain the patient's consent to the treatment, but in order to do so, the patient would have to undergo some kind of additional treatment. For instance, it is possible to imagine a scenario where a patient is under anesthesia and we discover that there is an additional problem, which was unknown in advance, and for which we would need to conduct a different procedure, for which the patient had not given his informed consent. This problem can be solved in advance if the patient appoints a legal representative who may decide on his behalf, and or if the patient is aware of such a possibility before the beginning of the treatment and gives his informed consent to an optional procedure in advance. According to the common point of view, if the patient is not in posse's sign of the information in advance and did not give his consent to the matter, the new treatment must not be given and the patient's consent must be obtained. However, another approach claims that if the person authorized to grant informed consent on behalf of the patient is a parent or partner, especially spouses, then there is no need to stop the procedure. This view is acceptable in societies where the family plays a great role in the individual's life. It should be stressed that if there is a real and immediate danger to the patient's life, if
The question is, should Dr. C have postponed the operation until Mr. M was able to give his consent? My answer is no, because removal of the testicle was a necessary part of the operation to repair to the hernia. The need to remove the testicle could now have responsibly been ascertained before any surgery was undertaken, and consent for future surgery was implied in Mr. M's request to repair the hernia. Thank you. Thank you for watching.